Dr. Ruth Carrico, welcome to the Valder Beebe Show live out of Dallas, Texas. How are you today?
I am doing fabulously and hope you are too.
Well, I am, and you're going to try to keep us healthy during the holiday with your information, so let's get started. I'd like to know what respiratory viruses should people be looking out for in this holiday travel season?
You know, there are a number of them, but there are several that are just particularly a problem. Some are familiar, like flu or influenza, and certainly COVID-19 has not gone away. But also we have respiratory syncytial virus, or RSV, that is gaining a lot of traction and a lot of attention. So all three of those are diseases of breathing, and breathing is something we all do. So these are ones to keep in mind and figure out a plan of action.
Okay, so how can we help protect ourselves? We've got people, I'll just tell you from my perspective, I've got people family coming from all over the United States into my home for the holiday. So how do we protect them and protect us?
You're right, because they may bring a wonderful dish, but they may also bring something else, and that is, one of these respiratory viruses. So let's start off with remembering, what did Mom tell us? Well, Mom told us keep our hands clean, stay home when you're sick, and if you've got a cough or sneeze, do that in a tissue or your elbow. But there are other things that can be done, and so I'm happy to have the chance to partner with Sanofi to provide additional information about vaccines and immunizations that can go a long way against those three big problems.
Excuse me. I'm going to take this from Instagram. My audience is on multiple platforms. And the poster said, you're giving good advice, but how do we bring this up with people who are visiting us for the holidays?
Well, I think it's a reminder that, we're all unique, we're all special individuals and have a lot of special underlying health conditions. So I think it's a reminder, working with our healthcare providers. So you may have somebody that is coming to your home. Maybe they are an adult that is 65 years of age and older. We know that as we age, our immune system begins to falter. It's a good time to say, hey, we're going to be getting together. How about making sure that you've talked to your provider about your flu vaccine? We know that older adults have a higher dose flu vaccine available for them that may be more effective. Also remembering COVID vaccines, mRNA and non-mRNA vaccine. Then our older adults also are eligible for RSV vaccine. So reminding them about that importance. Then remember, we may also have our little ones that are part of the party, particularly toddlers and infants. They are trying to develop their immune system, so they need our help. So let's surround them with both individuals who have been vaccinated, but also take advantage of some of these things. We know we have these immunizations, an antibody that can be provided to our infants to help protect them against RSV. Also, others of us with underlying medical conditions that we may not think a lot about. We feel pretty good, but oh my gosh, I've got diabetes or asthma, or maybe I've got a few extra pounds, even before the holidays, a few extra pounds. What is it that I need to do? That there are vaccines that are important for us. So as you mentioned, it takes all of us working together to say, let's collectively work on having a happy, healthy holiday time. And that requires a little bit of planning, doesn't it?
It does. I want my audience to know I'm speaking with Dr. Ruth Carrico. You guys know it's my job to find the best people on the planet to give you the best information. And she falls into that category. She's a nurse practitioner, a professor, and an expert in infectious disease for over 30 years. Dr. Ruth, finally, what do you want my audience to know as they gather these people from near and far in one place?
Well, I think it's a good time to remember everybody's different. Our health needs are different. Our perspectives are different. And so let's start with your healthcare team and develop a plan of action that makes sense for you, that is feasible for you, that is personalized for you. Also remember, it's never too late to get your flu vaccine, your COVID vaccine. Talk with your healthcare provider and they can develop a plan of action for you. It may involve taking advantage of your pharmacist to help then access a vaccine. So think about what makes you unique and special. Give consideration to a family get-together. Let's share what we want to share. Let's share good food, good conversation, and good love. Let's not share illness. And so that means we do what we need to do beforehand and work together to make this happen. Let's have a great 2025, and let's start off 2026 in a healthy way.
Dr. Ruth, this has been the best information I've received all day for my audience. I want to thank you for stopping by the Valder Beebe Show. It's been our pleasure.
Hi, I'm Valder Beebe, host of the Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/Valder Beebe Show. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to YouTube.com/Valder Beebe Show and stay connected as I interview the world's most fascinating people.